Let's see.
Okay, good morning, everybody. It's 11:31. We're going to get started. We're going to welcome Stephen from Sourcewise today. Skip?
So, as many of you know, we had a presentation on Sourcewise several years ago. They are our AAA for the area. No, not the car club, but the Area Agency on Aging. And we've already talked about it. There are lots of different programs within Sourcewise, and Hicap just happens to be one of them. Hicap stands for the Health Insurance Counseling and Advocacy Program. What a mouthful. And we're going to be learning about how they can help us and their clients and the families and what all they do. And I'll just turn it over to Stephen and take it away.
Well, thank you, Skip, and thank you, Julie, for inviting me over. My name's Stephen Rubalcaba, and I've been working with Sourcewise. I was telling Julie and Skip a little bit for those that were here early. I've been here for a real long time. I've been working here since 2010, so I have a lot of experience and Medicare information just rattling around in my head. So yeah, Hicap is certainly a mouthful. Health Insurance Counseling and Advocacy Program, which is a lot to say. So a lot of folks refer to us as Hicap across the state of California. And yeah, Skip mentioned, we are Santa Clara County's Area Agency on Aging, or AAA. So what does that mean? It means that we have a lot of aging and disabled services in-house. We are the organization to kind of start off at, is the way I like to say it. There's a lot of help people need, right? And sometimes it's finding out, well, where do I start? I mean, it can be a lot to deal with. So part of us being a AAA is we have an information and awareness team that's extremely knowledgeable on all types of programs and resources in Santa Clara County. So if we do not provide the direct assistance in-house, and there's a lot of stuff that we do not provide in-house. Here's a small listing of the programs that we do offer. We refer folks out to other local community-based organizations that can help them out. So it's a good springboard of sorts. And perhaps, I'm guessing that was the presentation that maybe came out here last time for y'all. They kind of talk on a high level of all the in-house programs at Sourcewise. So we also have our own set of social workers or case workers that are here to help folks that maybe do not have family or friends that can advocate for them. We also have one of the county's Meals on Wheels programs, which is a weekly, well, they essentially deliver a weekly supply of meals to folks in the community with the senior diet in mind. What does that mean, right? It means the dishes are low on sugars and low on sodium. It's absolutely free to folks. Oh, by the way, all of the programs here at Sourcewise are all free. They're not going to cost anybody a dime. The Meals on Wheels program is a little bit unique. They do ask for donations if folks can donate, but they're never going to turn people down if they're unable to donate, right? People need to eat nutritious meals if they're unable to go outside their home and go acquire those groceries. We even have a digital inclusion program, a newer program that issues out, well, they're trying to bridge the divide of folks not having the tech that we need to kind of access stuff, almost everything nowadays. So they're sending out free iPads or tablets to folks. They're even signing people up for free Wi-Fi and internet subscriptions. Now, it's one thing to give people this equipment and tech, right? But they're also teaching people how to use this stuff, right? Because that can be kind of difficult for a lot of people. Another one we have down in South County, Morgan Hill, Gilroy areas, transit services. Public transportation's a little tough down there, in case y'all do not know. So we're targeting folks in some of the more rural areas of Santa Clara County. Caregivers Network is a program that helps pay caregivers to take care of and keep safe their perhaps family, friend, or loved one. Public Authority Services, which I think is what Skip was referring to, They partner and work with the state and counties IHSS program, which stands for In-Home Supportive Services Program. And what public authority does, I know a lot about them because I worked in that program for 9 years. My goodness. Public authority, they are responsible for enrolling those caregivers in order for them to get paid by the program. They also provide caregiver benefits like health, dental, vision insurance. They also provide free training for these caregivers and or clients of IHSS, like CPR training, first aid, as some examples. Finally, they keep a registry, which is a list of IHSS caregivers for IHSS clients to hire from if they're unable to find any family or friends to do that work for them. So that's their responsibilities with respect to IHSS. IHSS, let me tell you right now what they do. They authorize the clients and their hours, and they do provider payroll, right? So that's where people's journey basically begins for IHSS benefits. We also have a fall prevention program that's somewhat new, trying to get equipment in folks' house to make sure they're not falling and make sure they have safety ramps, etc. And we also have one of the counties. This is a really cool program. It's basically a senior employment and training program for people aged 55 years old and older that are interested in getting back into the workforce in some capacity. The senior employment program is going to pay people to train them in certain fields and tasks, right? So it's a paid training. I believe folks have to be available for 20 hours per week. And again, it's paid. After all the hours of training are completed, then the Sourcewise Senior Employment and Training Program is going to help usher people back into the workforce, whether it be part-time, full-time basis. You decide, right? You tell us what you're looking for. And finally, my goodness, coming all the way down is the program I'm working for now since, geez, I think I started Hicap in 2019, is the Health Insurance Counseling and Advocacy program, which I like to start off by telling people what we do not do, right? So we do not sell any insurance. We do not represent any insurance company or agent. No nonsense like this. Our role and scope of work, it's pretty direct and to the point. Well, what is it? Let's help people understand the rules of Medicare. In case y'all don't know, it's a little complicated. Let's help folks understand what their rights are. The rules kind of change depending on what state you live in, right? Furthermore, let's help people understand what all of their Medicare choices are. They're different in every single county. And we unpack and share every single option to people, okay? We don't care, if I'm being honest, we do not care what people, what Medicare plan people have or what they may be interested in, as long as they are informed and educated when making those decisions. So there's no pressure, right? So again, all of our services are free. As I've been describing, it's objective and unbiased. We do Medicare counseling all year round, and we do it in person, right? One-on-one, face-to-face. We do it in a virtual capacity, kind of like what we're in right now. And we do it over the telephone for people. And we've recently implemented a appointment hotline, because let me tell you something. Most of our business requires an appointment. You think you have a quick question about your Medicare, usually it's probably not a quick answer, or one question turns into 5, 6, 7, 8 questions. But we set up appointments that last at least 1 hour long, and it can be common for people with more complex issues, perhaps. I mean, there's all kinds of different examples I can tell you later that may have or require follow-up appointments. We have people that contact us every year for certain needs. So this is the local number here for Santa Clara County residents, right? And if you have family or friends outside of California, outside of Santa Clara County, the state put together a 1-800 number, which typically routes people based on their area code. So more often than not, it'll get you to the right office. But if you've moved, then it may misroute you, but that's no problem. This is the right number to call. Whomever you get on the other end, if it's not your respective county, ask them for the whatever county you live in for that direct number. That's what I do all the time when I'm answering those phone calls. But Hicap, we're a part of a national network called and it's another acronym that nobody's going to remember, but it's called the SHIP program. Stands for State Health Insurance Assistance Program. And we're ultimately managed by SHIP, that is ultimately managed by the federal government or Center for Medicare and Medicaid Services. So that's why we're not allowed to sell nothing. We're not allowed to tell you what to do. You're all adults here. You have to make your own decision. We can just kind of guide you on that journey. And we're all across the country. So if you have friends and family living outside of California, this website will get you there. Hey, by the way, I'm sharing all kinds of phone numbers. I'm showing you website links. There's no need to scribble any of them down, I don't believe, because I'm going to send the team here the slides that we're viewing. I'm also going to be referencing a Medicare consumer guide, which is a complete listing of every single Medigap plan, every single standalone Part D prescription drug plan, and every single Part C Medicare Advantage plan. So we're going to give you all of those as well in case you're curious of what's out there and what this stuff is costing.
Is that Medicare and You that you're talking about?
No.
Look.
No, I'm not talking about that quite yet. No, sir.
Okay. I'm sorry.
No, it's okay. The consumer guide I'm referring to extracts information that's only specific to Santa Clara County. Medicare and You, it's a booklet that gets issued out to everybody that's on Medicare from the federal government, but they're all state specific. In California, there's two versions, one for Northern California residents and one for Southern California residents. So we take out all the nonsense and only give you Santa Clara County info. But I can send you Medicare and You booklet too. I have a electronic version of that for California.
It can be downloaded too, not a problem.
Yeah, absolutely. And so Hicap here in our county, we've been rocking and rolling for a long time. So we've had years and years and years to build rapport and be present, providing counseling, one-on-one counseling. I do a lot of outreach at these various sites too, like the local community centers, the senior centers, the public library systems, and you even catch us at some of the hospitals here within the county, providing Medicare counseling where people are at. So we're trying to keep hurdles low, right? Meet us in person, call us on the phone. We can do it virtually. So we provide a few different options. And I think I started sharing a little bit about Hicap's inception. Well, let's just call it Medicare advocacy, right? There is no such thing as a Medicare office you can walk into and ask these types of questions. They don't exist, okay? Most people were getting their guidance and advice from insurance agents, right? No offense to insurance agents. I think a lot of y'all here are some of those as well, or perhaps were some. But some of them may only sell or promote certain products, right? Maybe products that they're only selling. And in the early 80s, there was a lot of Medicare beneficiaries with questions on this stuff, wanted objective types of counseling. So up in Palo Alto, as a matter of fact, here in Santa Clara County is where this type of service began. And earlier on, and you can kind of, here, I'm not going to read this here, but towards the end of the 80s, the state of California had noticed that Hicap or Medicare advocacy was kind of expanding in the state. So California adopted it as a state program. When was it? 1989, right? And then fast forward to the 90s, the federal government took note of what California was doing. Seems like California has always been trendsetters with respect to legislation and rules and services. Me, I'm born and raised here, so it's all I know. But the federal government caught wind of it and then adopted it as a national program. Instead of calling it Hicap, they called it the SHIP program. So all across the country, people can get free, objective Medicare counseling. And here in our county, we have, oh geez, I lost track. We're at 38 or 40 registered Hicap counselors. Me, I'm just one guy in Santa Clara County. And it's not like we just, there's a lot of people that want to help, okay? That want to help Medicare clients. And that's fantastic. But we do not just take anybody and everybody just because they want to help. No, 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 no. It's complicated topics. There's a lot to learn. The state requires that we go through at least 25 hours of initial training. Then there are 10 hours of shadow training where veteran counselors, so to speak, have to watch, new counselors have to watch some of the veteran counselors for 10 sessions. Then the new counselors have to be shadowed while we watch them provide in-person counseling for 10 sessions. Once people get registered and certified with California, fantastic, but it doesn't last forever, right? Me and all other 38 counselors have to continue our education, the rules and options and Medicare changes all the time, at least every year. So we have to continue our education and submit it to the state to stay active. And we also have to provide at least 40 hours of counseling in the calendar year in order to maintain our registration. So it can be a little bit intensive for a lot of our volunteers. Most of our counselors are on a volunteer basis. They've been with us longer than I have, smarter than I am, know more than I do about the program. I'm learning all the time. And we do have counselors here that speak a variety of languages. And I'm sorry, but I barely speak one language, that's English. I'm still learning stuff with that all the time, learning how to tighten up my communication skills. But we have counselors that speak English, Mandarin, Cantonese, Hindi, Spanish, Vietnamese, just to name a few. If we're unable to communicate somebody's specific language, then we have a language or interpretation service that we dial up on the telephone. But we do prefer to talk to people in their own native tongue when at all possible. So there is a lot that goes into being a counselor, and our office here, we are, well, our scope of work is Santa Clara County residents only. I only know about Santa Clara County Medicare products available. So if anybody is Medicare eligible, you can call us, about to be Medicare eligible. Maybe like me, I'm far, not that far, but I'm kind of far from Medicare eligible, but there's a lot of people helping out their parents, their grandparents, other family members. Okay, so we help all of those folks. And we also assist people with, so there's a lot of confusion on Medicare, which I'm going to talk about, who qualifies for that, and Medi-Cal, which is the state's Medicaid program. Medi-Cal, right, is for all ages, but it depends on how much income we have coming in. So it's for people that are low on resources, low on income. It's our state's safety net health insurance program, okay? Medicare, on the other hand, is essentially for people that are 65 years old or older. Medicare was written into law, by the way, back in the 60s, 1965, I believe, is when this was written into law, okay? And not only is it for people age 65 years old or older, there are some individuals that qualify for Medicare that are younger than 65 years old, but they have a disability that is set by Social Security Administration. So if somebody is collecting Social Security disability insurance or income for 2 years, on that 25th month, that person is eligible to sign up for Medicare, should they choose, right? And some people that get these nasty diagnoses like end-stage renal disease or kidney failure or ALS or Lou Gehrig's disease, once those folks get that diagnosis, they are immediately eligible to sign up for Medicare. But most people in the Medicare system age into it, okay? And for those that are already enrolled into Medicare, maybe this looks familiar, this red, white, and blue card, right? It gets sent out to us by the federal government, letting us know when it was put into effect and activated. And Skip earlier was talking about the Medicare and You booklet. So everybody that is enrolled into Medicare automatically gets this updated version. Usually, I think it gets sent out around September of every year. And by the way, we order these booklets from the feds every year too, because there's a lot of people that either, I mean, I hear all kinds of things. I never got it. My dog ate it. This happened, that happened. But I want to tell you that it is available in other languages as well.
No, do I have to have an appointment?
You can.
Yeah, if you have a question, go ahead and I guess shout it out. But otherwise,
that
please
was-
mute your microphone.
Yeah.
And the Medicare and You booklet comes in other languages. So it comes in Chinese language, Vietnamese language, Spanish language, and believe it or not, the Korean language. So the federal government does translate it in those few languages. You, your friends or family need one in those languages. You could call 1-800-Medicare. They'll be happy to send you one out. You could even call us. We have extras in our office. I'll be happy to send you a hard copy if you want it. Okay.
And they have them in large print too.
Yes,
Sorry.
they do. We order them in large print. They order it. I even order them on disc if you want to listen to it. And if you have a CD-ROM, there's even Braille Medicare and You booklets if that
Wow.
is the need. Yeah. Yeah. So a few different formats available for sure. Yeah. Thanks for that. So I've been carrying on a lot and you still might not even know what Hicap helps do. Well, we help answer questions on original Medicare. You know, that red, white, and blue card we was just showing? How do we sign up, right? You might know folks that were automatically signed up for Medicare, and then you know other people that they had to sign up. So we know about, we answer all kinds of questions about original Medicare Part A and Part B, like boy. We answer all types of questions about this bullet point. This seems to be the most confusing. Medicare supplemental insurance, or the Medigap plans, right? And there's also a tremendous amount of marketing and advertising for the Part C or the Medicare Advantage plans available to us. And we have to make sure that we have prescription drug coverage, because in case you don't know, this red, white, and blue card, all that provides is our hospital coverage, okay? Should we get admitted into a hospital, and it covers our medical, which is our outpatient treatment. For example, you're not feeling good, you make an appointment to see your doctor. Your doctor says, Steve, you need an X-ray, you need some blood work, you need an MRI. That's all outpatient, okay? Maybe you need some durable medical equipment like a wheelchair or electronic scooter. That's all outpatient or Part B, like boy. Now, let me tell you something else. And you all know this, but Medicare is not 100% coverage, right? They roughly cover about 80% of the costs. Some ways to protect your out-of-pocket costs are with Medicare supplements or Medicare Advantage plans, okay? But point I was trying to make is that the red, white, and blue card does not include prescription drug coverage. It's a separate insurance plan you got to buy from private insurance companies, as you must buy Medicare Advantage plans from private insurance companies, and Medicare supplements are also sold by private insurance companies, okay? And you all probably know this, maybe not. Some of the Medicare costs are expensive, okay? It's not equitable, right? I mean, the prices are all over the place. Some I hear say, well, if money isn't an issue, you can get the quote unquote best of the best. And don't ask me, I don't know what the best of the best is, because they just don't exist. Medicare's not a one size fits all. It all depends on your current healthcare needs and what your finances are. So there's a lot of programs that help pay for this stuff, and we know what the income and asset limits are to qualify for these programs, like the state Medi-Cal program, which I briefly mentioned earlier. This can help pay for Medicare costs. There's also programs that are literally called Medicare savings programs. They help pay for Medicare costs. There's a program that is literally called Extra Help or Low Income Subsidy. The only reason this program exists are to help with prescription drug costs, okay? If you think these plans may benefit you, or if you simply want to know how to qualify, you could always call us, lock in an appointment. Matter of fact, I'll go ahead and send you the newest cheat sheet that we just came out with that give what the income limits are to qualify for these programs and what the asset limits are to qualify for these programs. Okay, I'll go ahead and send that out. It's very helpful. And there are, so for people that qualify for Medicare, you have a laundry list of insurance plans to choose from. People that qualify for Medicare and Medi-Cal, you have a few different plans to choose from. Basically, all the costs are zeroed out in those plans, but you must be eligible for both Medicare and Medi-Cal. We also talk a lot with, there's a lot of people that are new to Medicare. Maybe they have an employer plan, maybe they have a union plan, maybe their company's offering them a retirement plan. How is that going to coordinate with Medicare? Well, reach out to us. We know how the coordination work or doesn't work, right? Like there is no coordination with Medicare and COBRA, does not exist. There is zero coordination with Medicare and VA benefits, does not exist. So let us know if you have questions on long-term care. By the way, Medicare does not provide long-term care, period. Okay. There is a set number of days that Medicare will pay for hospitalization or skilled nursing facility. It is not endless. Okay. People that have the means and can't afford it would sign up for a long-term care insurance policy. People that cannot afford it, the state safety net long-term care is Medi-Cal. Okay. But for people that have to get placed in a long-term care facility that cannot afford it, Medi-Cal will pay for a bed, but also they collect all of that person's income. Okay, they're taking everything, but they're letting them keep about $35 or so. But anyways, we also help people with billing issues, appeals process. There's a lot of problems sometimes that people have. Prior authorization issues in the Medicare Advantage plan world. We can help y'all navigate those rocky journeys in the Medicare insurance world. They do exist, okay? We also can refer, we're not lawyers, we're not attorneys, okay, number one. But we can refer you to, we do have partnerships and we do grant. For example, it's called SALA is the acronym, and I'm spacing out senior something legal advice. But anyways, we do have,
They were on a few weeks ago. We know about them.
Nice. No, yeah, good. They
And by the
are very
way,
impressive.
does Hicap do counseling and long-term care insurance?
We do, yes. And thank you for that reminder. So we do provide counseling and long-term care insurance, although according to the state, we have to get a extra certification or registration. Right now, we have about 5 or 6 counselors that have that extra certification or registration. I'm not too sure the exact term that they're calling it. I am not one of them, but yeah, we do have long-term care counselors. Yes, we do.
And while you're at it, the volunteers for the program cannot be licensed to sell insurance. They can't be, there's a conflict of interest there. So all your volunteers are not insurance agents.
Absolutely correct. Thank you for adding that. I should maybe add that as a little bullet point. Yeah, none of us are allowed to be licensed insurance agents in any capacity. I mean, some people say may or may not be an obvious conflict of interest, but yeah, no, we're not interested. I'm sure you have a wealth of information, but we are not interested. No offense.
Yeah, I don't
Thank you for that.
But I do.
Clara, you need to put on you. Thank you.
And one other thing we have here too in the state of California is a senior Medicare patrol. There's a lot of Medicare fraud, waste, and abuse. Year before last, there was an estimated 65 billion with a B like boy in fraud, waste, and abuse, y'all. That's a number I just don't really understand. So for y'all that are on Medicare, you already know the costs, they go in one direction. Since I've been here, they usually go up, right? Costs are always going up in Medicare. I actually have some fraud slide. I'll talk about that in a little bit, but we do have a senior Medicare patrol. Her name is Nancy Lee. She was actually in charge of a bust down in the town of Los Gatos a couple of years ago. There was an outfit out there, some clowns that had a little business that were defrauding the local residents there, basically the Medicare program. And a tipster sent a tip up to our Santa Clara County Senior Medicare Patrol. Our liaison was looking into it, felt the need to move it up to law enforcement, and now these clowns were they're in litigation. I think they were accused of $6, $7, $8, $9 million of Medicare fraud to the nice people out there. So let's just be careful, but I'll talk about that a little bit later. And I'll go ahead and zip on through this slide, but no surprise, we do outreach and education, right? And of course it's free, it's objective. We are unable, speaking back to conflicts of interest, Hicap is not allowed to do presentations that are sponsored by health insurance companies. So there's a lot of health insurance industries that are doing health fairs, resource fairs that invites Hicap that we have to kindly decline because they're hosting it. We don't want optics to presume or assume people that we are promoting these products by these people. So that is important to the state and to the SHIP and Hicap program. But we do all kinds of different programs, like what is Hicap, what we're doing right now. We know people are new to Medicare all day, every day. There's somebody turning 65 right now. So every month on the third Thursday of each month on Zoom, we do introduction to Medicare presentations. We also do them in person. We do presentations to help folks understand how Medicare works with Medi-Cal and all those other programs. We do Medicare fraud presentations, well, how to prevent yourself from falling victim to Medicare scams. Long-term care presentations we're starting to put out into the World Wide Web and into the universe. And we do custom presentations, okay? We do them for private, for-profit, private, nonprofit organizations, government institutions, nice folks like y'all. If you want to learn about Medicare, we'll be happy to inform and educate you about it. And this slide are just supposed to remind us to protect our Medicare number. Once upon a time, our Medicare number used to be our Social Security number. I think this changed in 2019 or 2018, 2020, I can't remember. But treat it like your Social Security number. Do not just go giving it to everybody willy-nilly. Most of our counselors don't need it. We don't ask for it. Medicare is never going to call you asking you to confirm your Medicare number. They're never going to call you saying, hey, we're going to send out a new plastic card. They're much better than the paper ones. They don't do that. Okay, they put everything in writing. Social Security, not going to call you talking about verify your SSN or Social Security number. They know how nasty fraud is. Check your Medicare notices, see what they're paying for. Okay, protect yourself, protect the program. There are some current scams that have been around for a while. Free genetic testing scams. There's no such thing as Medicare free genetic testing. They don't authorize that kind of thing. So be careful when you see them at the health fairs. I see the health fairs and resource fairs starting to pop up. There are some lingering COVID-19 scams talking about take this COVID survey, give me your Medicare number. We're going to send you a $200 gift card. You're never going to get that gift card. And Medicare might be getting billed for all these funky things in the background. So again, check your statement for accuracy. You see anything strange, call us. Like I said, we do have a senior Medicare patrol here. I don't know if this one will work, but I'm going to try it. Shout out if you cannot hear any of the sound here. I know in my Zoom, when I do them on our platform, I have to do something special. But let me just see. It's a little
I
recording.
think when you do the share screen, there's a little button that you select that can share the sound.
Yeah, share sound.
Yeah, share sound.
Here.
but like
Well, let
when
me,
you're sharing this, you might have to come out.
yeah, and you know what? I knew I probably shouldn't have did this for y'all, but let me
By the way, you're
do.
doing great.
Yeah, it's doing good.
I mean,
Only
Fine.
sometimes, only sometimes. And
why
now
don't you
let me
try playing it and see if we do get the audio, and if not, we can look at it.
Yeah.
Yeah, if not, I'm gonna send the link. I don't know if y'all see the proper screen though now.
Yeah,
You
we
all
can
see
see
this
it.
little.
Yeah, we don't have the audio.
Well, in that case, I'm gonna part of that slide has the little link. It's a little like 30-second video, but it's just kind of the overall messaging is there's a lot of phone scammers talking about I'm calling from Medicare, I'm calling from this, I'm calling from that. There's a lot of solicitors calling you. Now, if you're interested in hearing their sales pitch, by all means, go ahead and listen to it. But I mean, I would just hang up. No offense. Talk to someone who that you know is a trusted broker, trusted insurance agent. You just want to make sure that you're getting, from my perspective and point of view, I want you to be getting objective help, right? That's our cause. So that's all I think that is the best type of service and treatment. But if that's something you're looking for, feel free to leverage your local Hicap or SHIP program. We're here to just help you sift through the noise. There is a lot of noise in the Medicare system. And what I do want y'all to know, and you probably already know it, is that you're never locked into anything when you sign up for Medicare. There's always a annual or open enrollment period. Happens every year from October 15th through December 7th. That's when all the insurance plans are able to make changes to the plans and coverage for the next year. And they have to let you know. So they send you a notice around September, letting you know the changes with the cost and coverage. Exercise your rights, explore all of your options. And if you want help doing that, you can leverage us. So this is all of the ways to get a hold of us. I did just want to say thank you, but I'll go ahead and leave it back on this slide in case you want to scribble any of this down. But rest assured, we're going to send you the slides that you saw here and these website links. But I think now might be a good time to open it up for any questions that y'all may have
We do have
on
several in the
the
chat.
Hicap.
We have several in the chat feature you might want to look at.
Let's check this out then. Chat here. I see the number 6. I see some AI assistant talk. What are we
Yeah,
saying
go
here?
down, Joseph, where's the funding come?
Oh,
That's the first one.
so where does the funding come for Sourcewise? Is it a state? Well, here's what I know about Hicap, if that's okay. Funding for Hicap comes from county, state, and federal dollars. In case you really want to look, check this out. We even put all the state Hicaps have to put this little funding acknowledgement. So we're funding by the Administration for Community Living, or ACL, and the State Health Insurance Assistance Program, the feds. So all of our funding sources must be listed on here for the state. But county, state, and federal dollars, sir, is where our funding comes from. Do you
It
ever do
actually-
community fairs? Yeah.
I was going to say it actually starts from the Older American Act and then filters down to the state and then eventually the local counties and so forth among all the AAAs. So it's a quasi-federal program, if you will.
Nice. See, we have expertise from one of our previous advisory board members.
I just read a lot.
Mhm.
So, and in
And
addition to that, so can you tell us about how this program compares to the PACE program?
so the PACE program is, I know a little bit about PACE with respect to Medicare eligible folks. PACE is for anybody that has Medi-Cal, as far as my understanding, that is on the
Yes.
border of a skilled nursing type of care, level of care. So in order to qualify for a PACE program, you got to meet Medi-Cal eligibility. And if you're on Medicare, you could sign up for the PACE programs as well. So there are 2 PACE programs in our county. One of them is from On Lock. And by the way, on this consumer guide I'll be sending y'all, we're going to list the PACE programs. Unlock, and I don't know the PACE acronym committed to my memory, so I do have to beg your pardon. But there's Unlock, and there's a new player that came to town, I think last year, called Blvd Health.
Yeah, Wellbe
It's an
Health.
all-inclusive type of care where they go pick you up, take you to your doctor appointments. You get all your services done in one place for PACE. We actually did presentation about Hicap and Medicare and Medi-Cal over at the Unlock and Wellbe Health organization. So no, that's great. That's good.
Yeah, we've had Wellbe Health before, and we're scheduled to do Unlock in the upcoming weeks. So
Nice.
we're familiar with PACE then.
Yeah, those are really beautiful programs that help out a lot of people with certain needs for sure.
Yeah.
And then moving along, it looks like there's another question on, do we ever do community fairs? The short answer is yeah, we do. It looks like it's a two-part question. Do you ever do community fairs? Yes. Are they somehow are they something we could do a booth at or share info about what we do? If you're asking for your organization specifically, I don't know, perhaps. It seems like there's a value to what you do that the community needs to know about. And most of our community fairs that Hicap does, now I'm speaking on behalf of Hicap, we try to target our demographic, which is Medicare eligible folks, 65 years old and older, and or perhaps disabled people. For example, we're doing a senior health and resource fair at with Santa Clara Senior Center. I think that's coming up in May. We do them at Barbara Lee Community and Senior Center. We do them at a lot of these senior nutrition programs. It's basically lunch programs at a lot of the community centers. Yeah, we do a lot of health fairs. I enjoy going to some of those and mixing it up with the patrons there.
Is there somewhere we can go to find the schedule when you do those? Is it on?
Yeah, you can
Okay.
usually if so the schedule for most of Sourcewise and General's community outreach events, you could all find on our website under the events tab.
Okay.
And I can speak 5. Oh, looks like there's more of a comment. Namisha mentioned I can speak 5 out of these languages might be useful. I mean, I don't know how that's a question, but it sounds like an excellent comment. If you speak 5 languages, I bow to you. I struggle speaking 1. So I don't know. I mean, great. Good for you. Good for you. I don't
Any other questions? Anybody want to jump in and you can unmute yourself and ask?
Do this, I'll probably call him.
And while we're waiting to the person that speaks 5 languages, if you're interested in providing some valuable and meaningful volunteer work, circle into Hicap or Sourcewise in general. We would love to have your language skills informing and educating the community without bias if you're not a licensed insurance agent. We're always looking for bilingual folks.
One of the things I did. Go ahead.
Oh, I was gonna just say, Stephen, this is Lynn. I'm not, I don't have 5 languages, but I am trilingual. And when I have less business, then yes, I would love to come and volunteer. And I just thank you for being so resourceful. So are you then, you personally, you're a staff member or a representative for Hicap then?
Yeah, so there are, let me see, I'm trying to count the number of staff in my head. There are 7 paid staff in Hicap for Santa Clara County, and in total, as far as Hicap counselors, so the rest are volunteers, we have 38 to 40 Hicap counselor volunteers. Most of them, more than half of them have been registered counselors longer than I have. And even so, there's Hicap counselors, which can do one-on-one counseling with people. Then there's people like me called Hicap community educators, which we have to even undergo more training per year. So 12 hours to be a counselor plus 6 hours to be a community educator. So we also have to continue our education. You know, I'm always taking training to sharpen up my communicative skills. Or whatever, whatever it is. But we even have presenters or community educators
We have somebody that speaks Vietnamese. We have somebody that speaks Mandarin, Cantonese, and obviously some other English community educators. But no, those folks are volunteers. And our other English presenter, he does our intro to Medicare sessions on Zoom on third Thursdays. This dude is solid. He's retired. His previous job, I mean, he was a professional radio announcer. So dude is
Oh,
perfect
wow.
for presenting. His communication skills are clean and precise,
Wow.
easy to digest and absorb, in my opinion. So, but anyways, yeah, we have a whole team of presenters here. I'm lucky to have them.
Well,
But
thank
I
you.
lead
I
the
mean,
staff.
I mean, just listening to it, I'm like texting my dad and who is a senior, you know, he's in his 80s, and my sister
Mm.
who helps with my mom who has dementia, and then my brother who's a physician. So I'm sure all of them can benefit by having this knowledge.
Yeah, I mean, it's a good place to start. You know, you heard Skip mentioning rather the triple A's, or Area Agency on Aging.
Hmm.
They exist all over. So, you know, you can search for the AAA. More often than not, they'll have the Hicap program under them. Some
Hmm.
counties, Hicap is housed under county staff. Like I think San Diego County is Hicap. San Diego County staff provides Hicap services. So they're all county employees. But yeah, it's kind of unique the way that they have us all parsed out throughout the state. But more often than not, we're housed under nonprofit organizations, just like
Hmm.
Sourcewise.
We do have several
Okay.
people joining us from out of the state, so for you guys, you might want to find your AAA for your area and then find out if they have a high cap program. If not, there should be a SHIP program that you can use in your area. And
Yeah, and
so I just wanted to plug that these guys need volunteers all the time. So if you have the time and the energy and so forth, it's a great educational experience. I served for 12 years on the advisory council for Sourcewise, and I can't tell you how much knowledge I gained from doing that. But you're also giving back to the community and to all the various individuals that are using the Sourcewise products too. So I'm going to try to get some more presentations on other areas in Sourcewise that Stephen mentioned, and we'll try to give you a more comprehensive idea of what Sourcewise is. But Hicap is one of the most important ones. That's for sure.
Definitely.
let me tell you, well, that
Yeah.
is the sweetest thing. Very kind words, Skip. Thank you. Thank you for sharing that. I mean,
All right, you can pay me the
lot
20 bucks.
yeah, and real quick, most of our volunteers at Hicap, they all, the way that they ended up meeting us was joining a session like this, whether it be, you know, over the internet or in person, and or maybe having a one-on-one counseling session provided to them. They saw the value, wanted to give back, kind of thing. And a lot of the Hicap counselors kind of enjoy solving puzzles, you know, they like playing in the details of things and really helping people in, you know, such a complex topic like their healthcare. Some people are sick when they come to us, and you know, it can be such a relief for people. And yeah, I mean, I'm not doing this to get rich. It's a nonprofit organization, but it makes me feel good. Like I'm paid staff, but I'm paid to help people, right? And it makes me feel good. So no, yeah, most of the counselors came to us and became recruited by way of presentations or one-on-one counseling themselves. So no, yeah, it's been really nice.
Most
We
likely
have some
you're
really
doing
impressive
more work than you're
counselors.
getting paid for too.
Hey, I am, but I get to come here, mix it up, and have fun with you all.
There you go. There you
So
go.
Joe, why don't you ask him what your idea is?
Hmm.
Mr. Lamb?
Yeah, and I'm sorry if I missed any
What are you
any
talking
okay,
about?
look here. Let me go back to the
No, go
chat
ahead.
here. Yeah.
No, yeah,
Joseph's
Joe,
going
go
to ask
ahead.
in person now.
Yeah.
What was that you had in mind for me to ask about what?
doing a client-facing events.
Oh,
So
yes.
Stephen, have you ever done any events? Do you know anybody that's out at the Villages? Do you know where the Villages is?
Yeah, we used to do presentations there all the time. We even have a counselor there that does counseling for those residents. Yeah, yeah, very familiar with the villages.
So you have a counselor there. So Joe, there's the connection. So that person is who we should connect with when we're discussing having homeowner facing events out at the Villages.
Yeah, we used to do a lot of them over there, especially
I
during
haven't seen you come by lately. I don't know. I live in
no,
the
since
village.
COVID. Since COVID,
Yeah.
I haven't seen y'all. I can't recall the
Oh.
name of the coordinator there that I would work with, but no, yeah, since COVID, I used to drop off brochures and flyers, and I would lobby for us to get out there in person. But I hear crickets, so I'm not chasing people too much, I guess is what I'm trying to say. Have your contact reach out to me. You'll have my email. I'll give you my email.
Okay,
Yeah,
good.
But I'd be
we'll pick
delighted to
that
get back
up.
out there is the answer to the question. I'd be delighted to
Yeah.
get back out there.
Yeah.
We do
Definitely.
those types of things all the time. I was at so we do senior living types of facilities also with respect to outreach mostly. I was at a place just last week, Monte Vista Terrace out in Mountain View. We had a group of like 60 people. My God. We did a Mandarin and an English presentation over there just on Friday. But no,
Wow.
yeah, we do those types of places all the time.
Nice. Amazing. And Namisha, you were talking about some client-facing resources with Sourcewise, and they do have, and we'll let Stephen talk about what he knows about, and then I can share with you some of the things that we've already done as senior real estate specialists.
Thank you, Julie.
Yeah, I mean,
Go ahead, Stephen.
So what I'll be sending you all, I'm going to send these slides. You can share with whomever. It's got the phone numbers and links. I'm going to share with you our Medicare Consumer Guide, which is specific to Santa Clara County residents. Share with whoever. It's not going to be valuable for people outside of the county, but by all means, share it with whoever. I'll also be emailing you the Sourcewise community brochure that lists all those programs that we have and on a high level, what they do, who to call, how to sign up for them. I have them in English, Spanish, Chinese, and Vietnamese. I'll email you all 4 languages. And I'll email you some general multi-language Hicap flyers promoting those programs that help you save money on the costs. And then just a general Hicap flyer on why you might want to call us. But yeah, no, I'll send you soft copies of those. If you ever want me to mail you physical copies, I can do that too. Just let me know where to mail them. And for that, I will leave it to Skip and Julie to provide me an address on where to mail some of the physical copies if that's what y'all want to.
Yeah, and
I
then
want to send this stuff to y'all.
Yeah,
So
and we
please.
just we can use PDFs and digital copies because
Yep.
We're our own businesses. We can make our own media and collateral. So
Hey, we can do and/or, like I can send, I mean, I
Yeah.
volunteer to send hard copies and soft copies. I mean, we have physical copies of all this stuff in-house for sure. Like we order them and pay for them, or we order them from the feds, et cetera. But no, yeah, I can do whatever y'all want, whatever you need, just let me know. And if I can't do it, I'm going to tell you I can't do it. I don't have it.
And don't forget,
You'll learn with me.
We are
My
reporting.
communication style here, in general in life, is I try to be concise, direct, and to the point without beating around the bush. So the more clear, concise, and direct y'all can be, we are here to help is the key. We are here.
Yeah.
But I'll decipher messages as well. I'll figure it out.
And this session
Yeah,
is being
definitely.
recorded, don't forget, for you guys.
Mhm.
Well, what I'm envisioning at this point is this this information that we can use in our practices with our clients. And for me, actually, because I do a lot of agent training, so I'm going to be sharing this with the agents in my brokerage, the agents that are in our SRES networking meetup group, because we do go out and talk to people all day long, seniors, senior homeowners, and the families of senior homeowners. So we will have all of your contact information. It's in the bulletin. It will be in the bulletin again as well as on these slides. You have your contact information right there.
Yeah, and I think the biggest value for you, your org, and the staff there would probably be the Sourcewise community brochure I'll be sending y'all. I'll send you 4 different languages and the 2 multi-language Hicap brochures.
Yeah,
If you can get those 3 out to folks, that will be a huge bit
that
of
would be
wisdom and, you know, a
amazing.
couple of different brochures. Yeah. And then the rest is nice, fun, extra stuff that is only going to be good for this calendar year. But otherwise, no, yeah. I'll send you a bunch of good stuff, okay?
That would
Yeah,
be amazing.
I have too much stuff is the problem. It's like I have to have a lot.
Can
I'm
never
not
be too
joking.
much stuff.
Can never
Oh
have
boy.
too much stuff. Too much stuff. So yeah, we do have a couple of our participants are from different areas. We actually, Roni's here, he's from Long Island. So and Sherry's from Michigan. And let's see.
Wisconsin, wasn't it?
I'm here in the office and I have to change my insurance this year. I'm 65 this year. So maybe I'll call.
Oh, you're perfect. Okay, so this is Katie, she's my colleague sitting right next to me, but she's also one of my seniors that I work with.
Yeah.
And she and I are both in the same boat. So this is just amazing just for us personally. Personally,
Yeah.
now, because all this information is stuff that we did not know before 11:30 today.
Yeah, my friend was saying, you have to change it, because I love my insurance right now, but he says I have to change it. Is that true that we are mandated? I have Valley Health Plan. Do I have to get on Medi-Cal? Medicare or whatever?
So there's a couple of different things. For people that turn 65 who have health insurance through their employer health plan, right? Whether it's from your employer health plan or your spouse's, that plan has to be due to active employment. Okay? And then you can delay Medicare enrollment. Okay. As long as you're covered by an employer health plan, no problem. You can delay Medicare enrollment. For everybody else, you will be forced to join Medicare. In other words, for people that have perhaps the Affordable Care Act or Covered California, or a lot of people know it as Obamacare, you will no longer be eligible for that subsidy. They will force you to join Medicare. For people on Medi-Cal only, the state Medi-Cal office right now is paying 100% for your healthcare costs. Once people qualify for Medicare, the state of California says, hold on, they're going to force you to sign up for Medicare, the federal program, because now all of a sudden, the federal government is responsible for 80% of the healthcare costs, and now Medi-Cal is only responsible for 20. So the short answer is yes, they will make you join a Medicare program. It's basically to help with the costs that go on in the background.
And
So
we're scheduled to have a talk on Medi-Cal the 20th of next month.
Yep,
very good.
that's
Good.
gonna be
I don't
a
think it's
totally.
legalized. I heard I have to get on it.
No, there's an explanation for that. And let me just tell you this about, we're realtors. We don't have employer insurance.
Yeah, we don't have it.
We don't got anything
We're
like,
independent contractors.
yeah.
Yep.
So-
So you're gonna have to join Medicare unless you
Yeah.
want to pay.
And that's
yeah.
not a bad thing. So now you just have to figure out your options, and this is make an appointment with,
Yeah, okay, I'll just make.
yeah, because
Exactly.
that's gonna be perfect, a perfect resource.
Yes.
Make an appointment with
And
you.
one other thing, and for those, and I'm sorry, but briefly, I just plugged into the chat here. We do, we're doing a introduction to Medicare presentation on Thursday at 11 on Zoom. And at this session, we talk about the initial enrollment period for people just about to turn 65. What do you have to do? How long do you have to take action? You know, there's a window that you have to take care of business. We talk about special enrollment period for those that have coverage through place of employment, but we also talk about late enrollment penalties. We talk about in Medicare, there's 2 models everybody has to choose from. Original Medicare which is how it was created in the 60s, red, white, and blue card. You go anywhere in the country. There's no network restrictions, no prior authorization. The alternative is called Part C. It's basically the privatized version of Medicare. You see the advertisements and marketing calling them Medicare Advantage plans. They're HMOs and PPOs, which means you have to stay in those contracted networks. And there are prior authorization requirements, and the plans are different in every county. So if you move counties, you got to find a new plan. But those are the two models we have to choose from. We talk about that. We talk about pros and cons of each of those models. We talk about costs of them. But anyways, you might find some good value in that session where we
Oh,
talk about more of
definitely.
the nuts and bolts
And-
of Medicare.
And
Yeah.
along with
Today I was
that,
just talking about Hicap, not really Medicare, right? Just
and
so you
along
all
with
know.
that, you might want to review our Medicare update program that we did in February the 10th with Melinda,
Yeah.
talking about Medicare too.
Yeah.
A lot of the same information will be in there, but it's good supplemental information to have.
Yeah. Yeah, there's all kinds of stuff that we don't know, about. Well, I hear a lot of clients, there's a lot of things that people just don't know about the program, and they've been on it for years and years and years, We don't know what we don't know. So come tap in with Hicap. There's a lot of stuff we know, and we'll provide objective responses.
Amazing.
Do we go through you, or are you just like an information person? Who do we actually call to get help?
Well, you call this number listed right in front of your little screen. You hopefully see the 350-3288 is our appointment hotline for all of our counselors.
Okay.
Yeah, and it's all based on, so whenever people first call that phone number, they'll ask, what kind of appointment you're looking for over the phone. Do you want one virtually, kind of like this, or do you want one in person? If you say, and our appointment schedule is different from the virtual, is different from the in-person schedule. For example, people that want in person, they might ask you, well, where do you live? Or here are some of our sites that we offer it in person. Which site you want me to look at? Oh, Bascom Library or Roosevelt Community Center, et cetera, et cetera. And then they can find appointment slots for in-person counseling. Some people really like in-person counseling, and I get it, Me personally, I prefer in-person outreach. I'm fascinated with nonverbal communication. I studied it for a long, long time. So I look at what people's bodies are doing. Are they staring off into space? Do I see a deer in headlights? And for one-on-one counseling, I use a lot of those tools to see if people are comprehending what I'm saying. Some people will say, yeah, I understand. But the look on their face is like, Steve, you lost me. Let's go back 10 steps. So, but that's my preference. For me, I seem to provide better counseling, but maybe that's just all in my head. Who knows? But you have options. But I do counseling, if that answers your question. No, yeah, I have to do 40 hours every year too. I'm not exempt from that. I have to do it too. And I have a lot of return clients that come to me every annual enrollment period to shop around for their drug plan or shop around. Maybe it's their birthday month and they want to look at the different Medicare supplements. Or again, maybe it's open enrollment. They want to change their Medicare Advantage plan. So no, yeah, I have repeat clients too that lock me in every year.
Yeah, real estate agents know all about CE requirements, that's for sure.
Yep. Continue that education. My goodness, that's right.
So can we have your direct email address, please, in the chat?
Sure, let me drop it in there.
Yeah.
I only got a couple months. How long does
Yeah,
it
so
take?
feel free to reach out to me for any outreach opportunity. General questions I can do my best at answering. In-depth questions, I'm going to defer you to our appointment scheduling team, okay? Just to be full transparent. Most of my outreach, every day, usually I'm out in the field somewhere. Yesterday, I was not, thank goodness it was Monday, but more often than not, I'm out of the field in my work days. But I do respond for sure. Just give me some time, I guess is what I'm asking for. Because
Amazing.
usually when I do these presentations, if everybody emails me for Hicap questions, I'm done. I'm never gonna survive.
No, not at all.
So,
No.
like, okay. I got, let's see, it's
So,
May.
when you make your appointment,
I
you
got
can
3
figure
months.
all of that out.
So I
Yeah,
gotta, I
Yeah.
probably should get on it now, right?
Yeah.
I got 3 months.
yeah, yeah.
Yeah, like here's some advice that I think was being asked. When should I start looking into this stuff? Well, in a perfect world, I would tell people start researching this stuff 3 months before you turn 65 if you can, right? Don't wait till the last week. Don't wait. Oh my God, my birthday's tomorrow. I got to do stuff. Come on, stop it. Be prepared, right? If you can, 3 months in advance, 2 months is okay. But if you're turning 65 next month in May, lock in an appointment right now. You're a little bit too late. Last thing you want to be doing is acting on impulses and emotions when making these decisions. Okay, so give yourself some time, lock in with us. Most of our appointment availability is out sometimes about 1 to 2 weeks into the future. So somebody call in right now can probably get an appointment 1 to 2 weeks into the future.
Okay, so do you have any recommended plans? I know there's like silver sneakers, is that included?
I have no recommended plans, no.
So that's all
can't do
part
that.
of what you can ask about
ask
during
for.
the appointment.
Okay.
Yeah. So Roni, did you have a question?
No, actually, but I have been doing some research because in New York, I'm in Long Island, so we have Nassau and Suffolk, which is one thing. We have the city of New York, so everything is a little more separated. But I have been cutting and pasting some of the information he's been putting, so I think that I'm gonna end up having to do some additional research on my own. A lot of this information wasn't really stuff that I was aware of, which is surprising because I read a lot. So, a lot of it I really, really didn't know. So that's helpful. That's stuff that I can even use for even certain of my family members. So this is definitely educational to say the least.
That's why we're
Well,
doing these sessions.
That's right.
So
Thank
this
you
is-
so much.
This is a federal program, does it?
So we're gonna,
Insurance in other counties?
yeah, so I'm gonna help you out with that. So
Yeah,
we're
hey,
gonna,
and one other thing I wanted to say just real quick, and I know we all hungry. I don't know about you all, but I got the munchies. But one thing I wanted to share, because I heard somebody talk about silver sneakers. Now, what is Medicare? Medicare is healthcare insurance, right? You're shopping for your healthcare insurance. Let's not lose sight of what you're looking for. So what am I trying to say? When making your decisions on your healthcare, focus on a couple of things. The way I do my counseling is I don't start off by saying, hey, what shiny extra benefit are you interested in, like gym memberships and dental? No, focus on access to care. What am I trying to say? What hospitals and clinics are you going to, or do you want to go to, or continue to go to, right? Do you have any doctors or specialists that you are seeing now that you want to continue to go to? Maybe you have some surgeries lined up. Find a Medicare Advantage plan that can accommodate those needs. Keep in mind prior authorizations are there as well. Keep in mind costs, okay? And figure it out that way. What hospitals and doctors do you want to see? If you have a bunch of specialists all over the place, maybe original Medicare might be best for you because it's flexible. Maybe you're not a fan of prior authorization requirements. Well, then original Medicare may be best for you. I counseled a couple, married couple. For one of them, they opted for a Part C Medicare Advantage plan because of cost, right? Money is an issue. And the other one, because of healthcare needs, they opted for original Medicare because they had specialists at Stanford and San Francisco, et cetera, et cetera. They needed to get out of the network. So it's not a one size fits all. And there's no such thing as a best plan. Just be careful for those, those sweeteners. It's nice that they are there. We need them, right? But don't go chasing those. Focus on access to care for hospitals and doctors is my best advice. Once you figure that out, the rest is easy, and not much emotion involved.
amazing.
And that's all I have to say in closing.
So, yeah. So thank you so much for all this information. Like I said, that this is brand new information that we can utilize definitely for ourselves and our business practice. We really appreciate your time and the engagement now that we're going to have with you and Sourcewise going forward. So, does anybody else have any quick questions or comments? I got lots of ideas, and we're gonna be talking about all the ideas. We got lots of ideas that we can bring to our clientele, our family, our friends, our colleagues, and we're gonna be able to co-brand, and that'll just help us in what we do, and that'll help Stephen and Sourcewise as well. So I'm really looking forward to that. Skip, you got anything?
Yeah, next week is going to be the Ombudsman program with Catholic Charities.
Yeah.
I'm sure most of you don't even know what an ombudsman is, let alone how to spell it. And we'll go over that in detail. And I just want to remind you that we are recording these sessions. We missed the first few ones we did way back in the beginning, but we've got like 40 of them now. And pretty soon, Julie's going to have a website on a place where we can put all these so that
We're
you can
working
go
on the
in.
website. We're working on the YouTube channel. We're getting somewhere.
But until we do, let's just hope. And we are recording them, and they will be posted eventually. So thank you all for your attendance and your participation in with this. I think it's really valuable to get some information about senior topics that are not mainstream real estate, such as what we're doing here, because you can only help your clients that way, when you have the knowledge and the skill set to be able to counsel them on what they can do. You don't have to be the expert. You just have to know to go where to find the experts.
Exactly.
I
All right,
have one
everybody.
question.
Go ahead, Roni.
I was just going over the chat. I understand that he's having something on Thursday around 11 a.m. on Medicare. That seems to be a very interesting program, especially for me in Long Island, because I'm actually dealing with a very senior population. I don't think I'll be able to make it. Is there a way I might be able to get a copy of that Zoom thing, or is that not possible? Is that something that we might be interested in doing on our own?
Well, you can certainly, well, let me tell you this, everybody who registers for our Zoom sessions is going to get the recording and all of the materials, whether they join us or not. That's one way we can get it. But one thing I want to tell you is that some of the general Medicare information is valid for your state, but every state has slightly different rules. California, I don't know much about your state. We're a bit more generous with respect to providing protections to our residents here, like as far as enrollment periods and stuff. But the recording may not be good for you in your state. I would implore you to reach out to your state SHIP program, sir. Get a recording from them. We all do the same thing, but I'll email it to you, no problem, if you want it. I just don't know how exactly valuable it'll be for a different state, for people that reside in another state. If I'm being honest.
Actually,
I leave it to you to figure that out. I leave it to you to share it. How about that?
all right.
I'll
Thanks a
send
lot.
it to you, no problem.
Thank you very
Okay.
much. I just registered, so I'll get it, and there's always something valuable in everything.
Yes, sir. You got it, man. Yeah, you'll get it.
Thank you.
All right, everybody.
Nice.
Thank you so much for your attention and participation. And
Stephen.
yeah, thank you.
Thanks,
I'm just
Stephen. Yeah.
appreciate it.
Thank
All right,
you
you
so
guys.
It's been a lot of
much.
fun. Yeah, happy to be
I
here.
already
Thank you all.
texted for an appointment, so.
Julie, I had a quick
Nice.
question. So this series is just for agents, correct? The series certified agents? Because I just think so much of what we say, like my sister who's caretaking for my mom would benefit from it, but you probably don't. I mean, so yeah, I guess my question is, could she join these meetings? But if not, it's okay. I understand.
Well, for what we do, and then I can have a separate conversation offline with you about that, because
Yeah,
we are doing some consumer and homeowner facing things.
Oh, okay.
So, yeah.
Okay.
Yeah.
No problem. Thank
Yeah.
you.
Thank you.
Julie.
All right, you guys, have a great week.
Okay,
Thank
you too.
Thank
Thank you,
you.
everyone.
Thank
Thanks,
you.
Bye-bye.